Ashley with Amare. So we are going to talk about doctors today, how to choose your doctor, what doctors are good at what surgery, why it's important to pick a proper doctor, and what doctors' jobs are. So today's topic is all about doctors. Before we start with that, I want to let you guys know, I kind of talked about it a little bit, haven't really talked about it much, but for you guys who can't get to me, or you guys who are halfway around the world that can't do lymph drainage with us at Amare, I am creating a post-op course. So it's going to be called Post-Op Essentials. It's an online course that basically takes you through all of the education and all the things you need to know post-op that we talk about in the room. So garments, foams, how to heal properly, all the things post-op, how to find an actual manual lymphatic drainage therapist, what actual post-op massage should be like, how to watch out for those Miami people that will mess up your surgery permanently, how to take care of fibrosis, how to take care of seromas. This post-op course covers everything. I am halfway through creating it. I will obviously continue to give you guys updates, but super excited about it. It is a lot of work. It's taken me a lot of time, but everything that I tell you guys in session that is like super specific to you, including in these videos, some of the things that I mention is going to be in this course. So it's going to be basically a 6 or 8 module course. Haven't decided yet. 6 or 8 module course. It's going to include everything, and it's literally going to walk you through step by step from day after surgery all the way out until 6 weeks, and talk about every single thing that could go wrong. Included in this course, you will get a checklist for every single day to make sure that you're doing all the things you're supposed to be doing. You will get the 4 Amare post-op rules that you should be following every day, as well as a bunch of other little goodies to keep you on track during your surgery. So that is the course that I'm working on. It is very exciting, and I will keep you guys posted and updated on that. I mean, every week I try to do a live, so as I do these lives, I will keep you guys posted and let you know what's going on with that. So let's talk about doctors. I saw a lot of clients today, and the common theme was the doctor thing. So I saw a couple people that had like post-surgery from before, like pre-surgeries, and this is their second round or their third round. And when I asked the common question, why didn't you go with the same doctor? They're like, oh, I don't know. Well, you do know, because you weren't happy with something the first time. Or they were too expensive and you wanted to go cheaper. Or they weren't available to do your surgery. So let's start from the beginning. A person, human being, decides they want to be a surgeon. They go to school to become a doctor first. That's usually about 8 years. They decide to do surgery, like an actual surgeon. Then they have to specify what they're doing. Are they doing, gallbladder surgeries, regular surgeries? Are they doing plastic surgeries? Are they doing, weight loss surgeries? Pick your field, pick your specialty. Okay, so they pick plastic surgery. So then you become part of the board of plastic surgery. So when you guys are looking for a surgeon, the board certified part, that's like a real thing. So you can be a surgeon and not be board certified, FACS, which is usually, I can't remember the actual acronym. There's a couple different boards, but they're basically, certified. Like really they've been through specifics for plastic surgery and they're certified. So there's that. There are a couple other boards that you can get certified by. It's really up to you guys to figure out what doctor you want to go with based on their certifications. So I'm not going to name names, but I do know there are a couple plastic surgery recovery places that are like, McDonald's. They're in and out. They're, do the surgery, get out the end. And they generally should have board certified surgeons, and I know a bunch of them that are not board certified. I had a client in my office 2 days ago who scheduled surgery with said surgery practice, and come to find out that the surgeon who she originally scheduled with was not board certified, which is kind of a problem. So there's that. She wound up switching to a doctor, the only doctor in that place that is board certified. So one of them is the American Board of Plastic Surgery, the ABPS. They are kind of like, again, the American Board of Plastic Surgery. They're doing all the stuff. The other one is the American Board of Facial, Plastic, and Reconstructive Surgery. They're the guys that are doing specifically face and reconstruction. So there are different boards that you're certified with as a doctor that do certain things or specialize and teach you certain things. And if you're certified with that board, that means that you do those things and you certified and are specializing in them. And that's really important because every doctor can do boobs, but some doctors do them really, really well. And some doctors don't. Every doctor can do a BBL, but the contouring and the shaping and the artistry of it is something that takes time and takes, knowing what you're doing. So just because a doctor does something doesn't mean they do it well. I have seen a gastroenterologist who has done injections into the glutes, and this poor woman winded up in a lawsuit and lost because she went to him for injections, which he did, which turned into necrosis, and she winded up all kinds of botched, which took lots of surgery to redo. And make better. And the reason she lost is because he is a gastro, not a plastic surgeon, and he is doing what he is certified for. He can go and take a weekend class and get a certificate to do an injectable, which is very different than lipoing your stomach and doing a fat transfer. So be very careful with what you're doing to your body and who you're doing it with. If you're going to do the thing, do the real thing. I also had another situation where a client came into my office today and had several rounds of Kybella under her chin. Now, Kybella, in case you guys don't know, is an injectable, and it's meant to firm up and tighten up, but also kind of like slim a little bit and give you a little bit of definition. I don't know the exact science behind it. I do believe that it's something to do with eating away the fat, or your body, your muscles, like eating away the fat so that it's more toned. Now, guys, these are injectables, which means that there is a certain amount of maintenance with it. Yes, if you have a little bit, Kybella can help. It can tighten up, it can firm, it can pull everything, and that's fine. But it's, again, an injectable. It's not going to be a substitute for surgery. So again, guys, if you're going to a med spa for liposuction, I mean, is it a certified surgeon that's board certified in facial plastic surgery? Because they have a board for that, where you're certified specifically for facial plastic surgery. The American Board of Plastic Surgery, which basically is full body, lipo, BBL, tummy tucks, like all of, even facelift surgeries, breast, that's like all the big surgeries. And then the FACS is, you know, dealing with face stuff, reconstructive stuff. There is other certifications for weight loss surgery. That is not the same thing as just a tummy tuck, guys. A tummy tuck from weight loss is a lot more intense than just a tummy tuck because you have extra skin. Because you're talking about the difference of, you know, and now skin weighs a lot more than fat when you're taking it off. You can lipo a certain amount and you're not going to lose like 20, 30 pounds. If you're taking off skin, yeah, you may lose upwards of 20 pounds because skin is a lot heavier than fat is. I know that makes no sense and it sounds crazy, but when you're lipoing, it's contouring, it's not fat loss. When you're talking about weight loss surgery, it is something completely different. There are a lot more factors health-wise that goes into it when you guys are getting these surgeries done. So again, just, you know, make sure you're understanding what surgery you're having first, then to look at your doctor and see what actually they specialize in. So when you're talking about what surgery you're having first, again, if you just had 3 kids and you need a hernia repair, which is an ab repair, on top of a tummy tuck, and you want some lipo done, you might want to go to a doctor who's done a really, really, really good internal core setting. But guys, that takes you knowing what you need for your body before going to a surgeon and being like, here's my wish pick, make me look great. Like, if it's more in depth than just lipo contouring, if it's more in depth than just like, oh, you know, I just want a little bit of a BBL or shaping, if you have, you know, I have a client who had cancer and needed to get lipo, you know, to get the thing taken out, and then while she was there, she got lipo and a tummy tuck done. But again, only a certain type of surgeon could do that. Not all surgeons are going to do that, and not all surgeons can. So this is where picking your surgeon comes in. Now, how do you find your surgeons? Guys, you can literally go online and look up, like, on the Board of Plastic Surgery, where they are. New Jersey has one. New Jersey has a board of plastic surgeons that are certified and accredited in New Jersey. Some surgeons are double board certified. Well, what does that mean? You have an FACS board and you got a regular plastic surgery board. They are double board certified. Some of them are certified in other countries as well as here. There are tons of different things that go along with that. But the Fellows of American College of Surgeons, I think that's how you say it, is the FACS. Those guys are, like I said, they're doing, you know, all of this stuff. And then, of course, there are other specifications that go along with that. Like I said, there is a very big difference between someone taking a weekend course and someone really training and understanding the techniques. And now there are definitely techniques that go along to this stuff, guys. If you're talking about, and I know you've seen the scars from a breast lift, you're talking about the lollipop, where they cut around the areola, cut down, and cut underneath the breast. If you're doing, like, lift and skin removal, something like that. Or if you're getting an implant in, you don't always have to go straight across to put an implant in. A lot of doctors will use the Keller funnel, which is basically like, it looks like an icing, like a cake icing bag almost. And the incision with that can be very, very small. It doesn't have to be a very long underneath the breast incision. It can be a very tiny incision. I've seen implants where it's a very small incision and they just lift and pop it right in, and that's it. And you have a very, very, very short incision versus a very long one. But again, guys, with certain surgeries, there are different things that you can do. I know Dr. Subio loves his tummy tucks. He is wonderful at tummy tucks. But he even talks about the certain techniques that he uses. I know other doctors here in New Jersey that have specific breast augmentation techniques as far as anchoring stitches and things like that make a huge difference in the way you heal and the way you look and the way you recover and the way your results last. Because again, guys, we can get this stuff done, but what about 10, 20, 30 years down the line when things start to droop or sag and you have to get like, you know, a revision? Well, there are certain techniques that prevent that. There are certain techniques that are different for your body and healthier for your body than would be on other people that create different results. So it's not a one size fits all, which is why looking for a doctor is not a one size fits all. That's not something that you should just be like, oh, well, her body looks great and she went to him, so I'm going to do that too because it looks awesome. You have to know what you're looking for and able to kind of pick the right doctor. So the first step is to figure out, okay, well, how do I know what I'm looking for? Well, again, do you need an ab repair? Do you need something like that? This is where talking to a professional, a specialist like me comes into play. And this is why we have our virtual consults, our online consults, our pre-op sessions, because maybe you don't know what you need. Maybe what you think you need because you saw it on somebody else is not what's good for your body and not what you need. And there are a lot of doctors where you will go in and you will want something that is like crazy beyond what you should be getting. And they'll be like, I'm not doing that to you because you don't have enough. Or you think you're going to lipo your whole stomach and you don't have enough fat. And they're like, I'm not doing that. I'm sorry, but we can do this instead. Or we can take it from like your thighs or something else instead. And you want to go with a doctor who's going to tell you what his limits are and not just do what you want. Because again, guys, you need to know actually what the limits are for your body. So I've talked about with lipo, how many liters of fat we're taking out. Anywhere from like 3 to 4 to 5 is like a good healthy range. 7 is like a lot. Anything above 7 is like really a lot of liters of fat. If you've ever seen what like a liter of fat looks like, I'm sure there are tons of doctors that you guys follow. If you ever look at the actual size, like that's a lot, guys. So when you're looking for a doctor, you want somebody who's going to educate you. Now, this is the second part of this video. It is not your doctor's job to do your post-op. It is not your doctor's job to educate you on your post-op. It is not your doctor's job to say, hey, no salt, gallon of water, this is what your garment should fit like, here's where your next garment is, here's when you move down into it, here's where you should go get lymph drainage done, here's how many times you need to... Guys, your doctor is for the surgery. He just spent 6, 4, 8 hours on your body in surgery. He's not going to spend another 3, 4, 5 hours explaining all of your post-op to you. Your responsibility is to find out what you need for your body. Your responsibility is seeking out a professional like me or a post-op coach that's going to help you, somebody who's going to educate you on the entire healing process. Your job is to find that person and do the recovery with them. So when we're talking about what your doctor, like what makes a good doctor, surgery techniques, education, information, and being realistic and safe. That's what makes a good doctor. Somebody who's going to be safe with your body and do what you want in a safe manner. Someone who's going to listen to you, someone who's going to listen to your results, someone who's going to listen to what you want and actually show you how to get to your goal. Recovery does not make a good doctor, guys. Everybody recovers differently. Recovery makes a good manual lymphatic drainage therapist. Recovery makes a good recovery specialist. But when you're talking about picking a good doctor and saying, oh, my doctor did a horrible job because he didn't recommend you for recovery or he didn't recommend lymph drainage and my doctor is just the worst because after the surgery, I just feel completely abandoned. Guys, it is not their job at all. That is our job. That is your job. That's not your surgeon's job. Your surgeon's job is to do the surgery. So when you're looking to pick a good doctor, look at the surgery. Look at how his body types come out. There are some surgeons that do tummy tucks where they're flat. Every single person is flat, 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 and square with no shape, no curves, no hips, nothing, just flat. There are a lot of women out there that want that rail thin look. They don't want curves. They don't want big hips. They don't want a big BBL. Then you go to Miami, and there are a lot of doctors that will even do a tummy tuck, and you have huge curves that just don't look proportionate. But again, a lot of girls want that. They want a bigger bottom and a really, really, really tiny waist and bigger boobs. And that's fine too, and you have doctors that'll do that. Then you have in Jersey a lot of doctors that'll do the natural look. So they'll do the tummy tuck with a little bit of lipo on the sides, a little bit of lipo on the front, some lipo on the back to give you contour, and shaping around the BBL, around the glutes instead of doing mass in the back. They'll do fat transfer to the sides, to the bottom, and a little to the top to get you that kind of like peach shape or that sweetheart shape for your glutes without making them overly disproportionate to your waist from the lipo and the tummy tuck. So again, a good doctor is worrying about those things, not lymphatic drainage, garments, foams, boards. That's not what makes a good doctor. That's what makes a good recovery specialist, and that's what makes you a good patient for doing your research and asking questions. Now, when you ask a doctor, do I need lymph drainage? They're going to say no. You don't need it. It's not necessary. Because in their eyes, your swelling's going to go away in 6 months to a year to 2 years to 3 years anyway. And they don't care about swelling. They care about the cut itself. That doesn't mean that it's not something you need. You definitely do need it. Otherwise, that stuff can become fibrosis and become permanent, and then we have a big problem. And then they'll go in and do a revision. And you're right back to the same swollen state you were before. So that aside, yeah, you do need lymph drainage right after surgery. Anywhere from 48 hours to 2 weeks out, depending on what surgery you had and where you're at and where your body's at. And that's something we also cover in the post-op course, is how to know. But that is not something that makes a good doctor. A good doctor is going to tell you, yeah, you can do lymph drainage, do all the things that are going to help you in your recovery. There it is. Maybe the nurses, and usually most of the times it's the nurses or the front desk staff that'll be like, you're still swollen, go get some lymph drainage, and if they have our cards and they have our information, they'll give it to you. Otherwise, you're on your own to find that, because that is your responsibility. So when looking for a good doctor, again, look for the cut, look for the care, look for the communication. Those are the 3 things to look for, is when he is in the room with you, when he is in the surgery, or she, when they are in the surgery, how are they handling things? That is what you're looking for, not their recovery, which everybody gets wrong. That is not their job. Make sure they're certified, look for their specialty, look for what they're good at, look for their techniques. Surgery is an art. Surgery is about proportion. Surgery is about getting your body to where we want it to be. But it is an actual cut, guys. When you cut a cloth, it is cut, and that is it. If I cut a piece of fabric in a star shape, it's forever going to be star shape. Even if I drown it in water and put a rock on top of it and it looks all messed up and weird because it's covered by fibrosis and swelling, it's still a star-shaped cut piece of cloth. That is not going to go away. Getting rid of the water and getting rid of the fibrosis and getting rid of that rock is what gets you back to that star piece of fabric. So that whole part, that is us. But your doctor is going to cut that cloth into a perfect symmetrical star, and that's it. That's their job. Their job is done. The end. They just want to make sure you're healing right, you don't have an infection, you don't have a seroma, and that's it. As far as the rest of your healing, that is on you, and that is on us, and that is where we come in. So that's all I have to say about your doctor. Make sure you are informed. If you guys want some suggestions, if you're like, hey, I don't really know what I need, like I'm thinking about plastic surgery and I want to know like where to find a doctor and all that stuff, you can set up a virtual consult with me and we will go through everything. And that's what those sessions are for. Those are a pre-op session, is to say, hey, this is my idea. I scheduled with this doctor. This is what was talked about. I want to know what my recovery entails. Or I haven't scheduled with a doctor yet, but I'm thinking about it, and this is what I want to know. What do I need to be looking for? Who do I need to go with? That's what our virtual consults are for, is so that you guys can still get that information, talk to us, and get some guidance. So I hope this helped you guys a little bit. I hope it made sense. There are tons and tons of websites out there that have board certified surgeons in your area that you can find, and tells you what they specialize in, what their techniques are, what they're good at. You can go to their website, you can check them out. Do your research on your doctor, please, guys. The same way you do your research on lymph drainage and everything else, do your research on your doctor, okay? I will talk to you guys soon. Thank you so much for watching. Have a great rest of your day. Bye.